What are common side effects of chemotherapy? This is probably going to be a 2 or even 3-part video because chemotherapy has lots of side effects. Chemotherapy means using poisons to treat cancer, and they're poisons that disrupt the cell cycle, which is the cycle a cell goes through when it grows and then divides into 2 cells. So, of course, cancer multiplies, so cancer goes through the cell cycle a lot regularly, and therefore chemotherapy can target cancer. Unfortunately, even as adults, we have parts of our body that are going through the cell cycle all the time. Our skin, our hair follicles, fingernails, toenails, lining of your gastrointestinal tract, so that's sort of your mouth, throat, esophagus, stomach, intestines. So they'll get affected. And also if you get any kind of injury, which we do get injuries all the time, and generally they heal without us noticing, but those injuries result in new cells being formed, new blood vessels being formed, and chemotherapy interrupts that, disturbs that. So I'm just going to, in this video, run through maybe 5 or 6 very common side effects, depending on how much chemotherapy you're having and what chemotherapies you're having, and a whole bunch of other factors. You may or may not get various side effects. It's not something that can be predicted. An oncologist will talk to you about the common side effects associated with your chemotherapy and the rarer side effects associated with your chemotherapy. But still, the side effects tend to be unpredictable, even for the same patient. So sometimes you might have mild side effects, sometimes you might have very severe side effects. So the first one I'm going to talk about is fatigue. So fatigue means not being able to physically perform at the level you can usually perform at. So an obvious thing would be if you've been for a long, hard run and someone says, go and do it again, you might not be able to. You'd be suffering from fatigue. So chemotherapy causes fatigue. I think one reason is I think chemotherapy drugs tend to attack red blood cells, so your blood can't carry as much oxygen. But there are probably many other mechanisms as well. And fatigue is hard to deal with. The only thing that I found that helps a bit is light exercise. In the case of exercise-induced fatigue, you would rest. With chemotherapy-induced fatigue, resting doesn't help. You rest because you have to, and then you're still exhausted. So fatigue is a difficult side effect to deal with. You're often given steroids in the chemo drip, so maybe for the first few days you're fine. Maybe you've got, again, completely depends on what chemotherapy or combination of chemo you're having. You may get given a dose of steroids in your drip that lasts a few days. You may be given steroid tablets. These have side effects as well, unfortunately. So that's fatigue. Next, nausea. So nausea just means feeling sick. This aspect of chemotherapy will often be described as nausea and vomiting. But vomiting is now not massively common with chemotherapy because they're very good anti-vomit drugs. Unfortunately, nausea is harder to deal with drugs. And yeah, I think it's for many people it's going to be the worst side effect of chemotherapy. Just constantly feeling that you're going to be sick. If you're given steroids for fatigue, some oral steroids increase your appetite. So you feel hungry, but you're feeling nauseous from the chemotherapy, so that's very unpleasant. Now, one of the most famous side effects of chemotherapy is hair loss. But in fact, many chemotherapy drugs don't cause hair loss. And I think the reason it's so famous is because the media like to take photos of women with no hair who are undergoing chemotherapy. I make no comment about that. It's just the reality of maybe what makes a good photo. Well, okay, so that was a comment about that, but I make no judgment about that. So many chemotherapy drugs don't cause hair loss. Some hospitals or some health systems will give you like I think it's called a cold cap, so like a chilled cap or like a cap full of ice or something that allegedly is gonna restrict the blood vessels in your scalp and less chemo will go to that part of the body and you'll get less hair loss. I'm extremely skeptical about that. Yeah, one day I'll read some papers on it or whatever, but yeah, I know of many patients who have done it and still got the hair loss. So I guess at this point it's worth mentioning that some chemotherapy side effects are described as temporary and some are permanent, and unfortunately healthcare professionals tend to not talk about the permanent ones enough, particularly to late stage patients, because late stage patients you're likely to be on what's called chemo for life, or at least have very long cycles of many chemotherapy treatments for years. So you sometimes hear that hair loss being described as like a temporary side effect, and you might see in medical literature it will say, or literature for patients, it will say hair loss usually ends within 3 months of stopping chemotherapy. Now, of course, that's no good to you if you're on chemo for life. But also, I would point out that when you do get hair growing back, it's often very different from the hair you had. Typically, it's very kind of frizzy, curly, very kind of stubbly and stiff, I guess. So that's hair loss. One of the chemotherapy drugs I've had called irinotecan caused hair to just stop growing. So when I was on that drug, I never had a haircut. Another one caused like body hair to fall out. Not very pleasant, but for me, it wasn't a huge deal, but still. And kind of a similar one to hair loss is like skin trouble and nail trouble, particularly nail trouble, I guess, maybe similar to the hair loss thing. So many chemotherapy drugs tend to make your nails very brittle, so they break easily. It's particularly unpleasant for toenails because it makes it difficult to walk. But even, for fingernails, so just having nails that break easily or rip off when you're tying up your shoelaces, that kind of thing. Really unpleasant side effect. Not a lot you can do, really. A lot of chemo side effects, all you can really do is like some kind of level of self-care, maybe some drugs, and maybe dose reduction, depending on the chemo drug. So yeah, chemotherapy attacking your nails is a really nasty one. So skin trouble in general is very, very, very common with chemotherapy. It may cause very dry skin, may cause skin on your heels to kind of go hard and crack, split open, which is incredibly painful. May just cause you to break out in spots a lot, which again is pretty unpleasant. And finally, GI issues, so gastrointestinal issues, really big. The cycle of constipation and diarrhea, and just stomach trouble, having a lot of gas in your I guess stomach or intestines, and that again you can do some things to manage that. There are drugs that help. If you feel sort of like acid reflux, then obviously there are just standard drugs for acid reflux. There's a particularly good Japanese one called takecab, which is very effective. It's one that you can use before the acid starts, so it's kind of can have a preventative effect. Really helpful. Takecab is a potassium competitive antacid, but then there's another big family of drugs called PPIs, proton pump inhibitors, and if you think this kind of drug that kind of neutralizes acid in your body, so yeah, that's an option as well, those proton pump inhibitors. Okay, one more, I guess. There will be a part 2 video, but I should talk about neuropathy, kind of nerve damage, nerve related side effects, particularly peripheral neuropathy, which I've done a video on, so watch that. So peripheral neuropathy is damage to the long nerves in your arms and legs, but there are other kind of neuropathies that you suffer from as well with chemotherapy. I've not come across any really convincing way to prevent this or to fix it. It's one of those things that's sometimes described as a temporary side effect. It absolutely isn't temporary for many people. I guess maybe I get a bit of a biased view of side effects because I mainly help out people who are stage 4 patients, so kind of late stage cancer patients like myself, and we tend to do treatment for a long time. We tend to do combinations of chemo. We tend to do high doses. So I guess we get the kind of the worst of the side effects, and we tend to get the side effects for extended periods of time. But anyway, part 2 video coming soon of more chemotherapy side effects and little bits of advice about how to deal with them. So I hope that's useful. Please post a comment with your experiences or your questions.